third reason the anesthesiologist gave in the retrievals for not just putting the patient to sleep was that he felt that it was unsafe and he didn't want to take on the airway. There's more nuance to this one, and probably the argument that more anesthesiologists would be willing to take on. As anesthesiologists, we encounter difficult or risky airways all the time. But because we don't usually have to intubate pregnant patients, this is something that we tend to encounter more often in the general population. There are some established risk factors for difficult airways that we commonly see in the pregnant population. Obesity, airway swelling, especially with preeclampsia or long labors. Emergency intubations in general are more risky, and oftentimes these are emergency situations when we're having to intubate a pregnant patient. But interestingly, despite these risk factors, the incidence in studies of difficult intubations is the same in pregnant patients compared to the general population. However, encountering a difficult airway means that it's probably going to take more time to put the breathing tube in. And this time factor is important for pregnant patients for two reasons. One, once you put the patient to sleep, you need to breathe for them. And how long a patient can hold their breath, how much oxygen reserve they have, is going to be less when someone is pregnant. The second thing is that pregnant patients are at higher risk for aspiration for many reasons. This is rare but devastating. And the longer a patient is asleep without a breathing tube, the longer they are at risk. If someone doesn't have an empty stomach, or especially if they're actively vomiting, this increases that risk even more. We can reduce the risk of encountering any airway complications by making sure the patient is in an optimal position and by having them breathe oxygen for a couple of minutes before they go to sleep. If a patient is disoriented, those steps might be trickier. I'd be lying if I said that this patient in the retrievals wouldn't make me nervous, especially once she got to the point of being so disoriented and vomiting. But doing things that make us nervous, constantly weighing risks and benefits, that's part of the job.